Hello dear learners, my name is Muna Jones. Today we are discussing colostomy. Def. This is an artificial surgical opening in the colon brought to the surface of the abdomen for the purpose of evacuating the bowel, which could be due to cancer colon, paralysis of the large bowel, and can be partial or permanent. Indications for colostomy: 1. Cancer of the colon. 2. Obstruction in the colon. 3. Patient with anal fistula. 4. Paralysis of the large colon. Classification of colostomy: 1. Temporal colostomy. 2. Permanent colostomy. Types of colostomy: transverse colostomy, ascending colostomy, descending colostomy. Post-operative management. Aims: 1. To prevent infections. 2. To maintain nutritional status. 3. To maintain hydration status. 4. To promote self-esteem. Receiving patient from theater. Post-operative care will start from the time I'm going to receive patient from theater, where I will check the condition of the patient, for any bleeding from the incision site and if patient is awake or not. I will also check the fourth line whether in situ or not. I will also get the postoperative orders and if there is any specimen that has been collected. Environment. I will nurse the patient in the surgical ward on the postoperative bed. I will ensure that I provide a drip stand for infusion. I will also ensure that all emergency equipment such as oxygen cylinders and the suction machine is available to use whenever need arises. I will ensure that the environment is well dusted to prevent infections and promote comfort. I will also ensure that the environment is well ventilated to promote free circulation of air. Position. I will nurse the patient in the lateral position during the effects of anesthesia to prevent aspiration. Then the patient will assume position of comfort after the effects of anesthesia. If the patient is unconscious, I will turn him every 2 hours to prevent skin breakage. Psychological care. I will continue reinforcing the psychological as in the preoperative care to make patient accept his condition. I also explain what has been done in theatre and the findings for the patient to appreciate surgery. I will explain all the nursing procedures being done to the patient, promote satisfaction and cooperation. I will involve the patient and relatives in the care for continuity of care after discharge. I will also allow patient and relatives to ventilate the fears and worries, and I will answer to them correctly and truthfully. If there is any patient who has had the same surgery, I will allow them to meet and share ideas to make him have feeling that they can still maintain normal life. Observations. I will observe for any bleeding from the site of surgery and reinforce the dressing or inform the surgeon if bleeding not stopping. I will also observe for pain and do nursing interventions that relieves pain, such as positioning the patient in the comfortable position and ensuring that the bed is well made, and give prescribed analgesia. I will also observe the skin color from the stoma site, as brown color indicates ischemia or gangrenous formation and red color indicates normal blood supply to the area. Normally the stoma start functioning after 3 to 6 days, therefore I will observe for the contents, amount, color and consistency of the stoma. I will also observe the vital signs such as temperature, pulse, respirations and blood pressure to monitor the progress of patient, and I will do this 1/4, half, hourly and then 4 hourly as patient progress. I will also observe patient acceptance of his condition and continue reinforcing the psychological care. Colostomy care. Observe color of stoma: red normal but brown or dark indicates ischemia or gangrenous formation. Observe the skin excoriation. Observe for patency of tubes. Observe for function of the colostomy, which normally start to function after 3 to 6 days. Inform the patient about the tubes and the colostomy bug. Care for the colostomy with aseptic technique to avoid infections. Use Nistidine powder at the stoma site to prevent fungal infections. Observe for any oozing from the stoma site. Change the colostomy every time it's half full to prevent spillage of contents, as it can excoriate the skin. Teach the patient on how to care for the colostomy for the continuity of care after discharge. Use deodorant powder to prevent skin irritation. Provide the patient with micro-tape to help patient cover the stoma as he baths. Educate patient to eat soft diet that is not gas-forming, such as beans, cabbage and eggs. However, teach patient to eat diet which is rich in proteins for tissue build-up, Carbohydrates for energy and vitamins to boost the immunity. Report any excessive drainage from the stoma. Stoma irrigation. I will also irrigate the stoma at least every day to empty the stoma from gases, mucus and fecal matter as well as moistening the colon. Then I will also pat dry the stoma site to prevent skin excoriation and also promote the colostomy bag to adhere. NURTRITION. Encourage patient to eat diet which is not gas forming to prevent discomforts. Encourage patient to be taking enough fluids to promote bowel movements. Encourage patient to be taking light diet that do not cause bowel irritations. Encourage patient to be taking balanced diet such as proteins, such as meat, soya porridge to promote quick wound healing. Carbohydrates, such as rice, nishima for energy. Vitamins, such as fruits, green vegetables to boost the immunity and promote quick wound healing. Teach patient to avoid eating irritating foods as they may cause bowel discomforts and odors. Elimination. Observe the intake and output to assess the patency of the stoma. Observe the color, consistency, and amount of stool to assess if there is any complication. Give patient enough fluids to promote bowel movements and prevent constipation. Give patient light diet to promote bowel movements. Empty the colostomy bug every time it is half full to prevent spillage. Hygiene. Ensure that patient is sleeping in a clean and well-dumped dusted room to prevent nosocomial infections. Ensure aseptic techniques every time you are carrying out nursing procedures to prevent infections. Always ensure that the dressings are clean to prevent secondary infections. Teach patient to avoid touching the wound as he may introduce infections. Always change bed linen whenever it is wet or dirty to minimize infections and promote comfort. Perform bed bath or assisted bath if patient able to remove dyed epithelial tissue and promote comfort. Perform oral care and hair care to promote self-esteem. Drugs. Teach the patient about drugs they have been prescribed to promote adherence. Give the patient drugs according to the dose, route, and time. Complications, infections, due to non-aseptic techniques used during patient care. Hemorrhage, due to non-sutured blood vessels and infections. Diarrhea, due to incomplete digestion. Adhesions, due to fibrotic formation. Peritonitis, due to hemorrhage or infections. Shock, due to excessive loss of fluids and bleeding. IEC 1. Care of colostomy. 2. Hygiene. 3. Nutrition. 4. Drugs. 5. Review dates. Thanks for watching this video. Kindly share and click subscribe button for more educative content.